Don't tell your community midwife I've said this, but I think birth plans are a waste of time. And the reason for that is you may rock up in full-on established labour and the midwife who's looking after you doesn't even get time to read your birth plan. Another scenario might be that you've written on your birth plan, under no circumstances do I want an epidural, and then in the throes of labour find yourself screaming for an epidural. What's the midwife to do then? Listen to the birth plan or listen to you in labour? Now, I've seen some shocking birth plans in my time. I can think of one. It was colour-coded, it was printed, it was laminated. It stated which track of music the woman wanted playing when she was X centimetres dilated. And this woman ended up in theatre with an emergency caesarean and she was absolutely gutted. She was completely disappointed. Disappointed that she'd had a safe birth of a healthy baby. And this is why I'm not a fan of birth plans. So I'm going to tell you about an alternative, and I call it a priority tree. Now, for those of you who are primary school teachers, you don't have to make it look like a tree. What I'd like you to do is write down everything you can think of that you would consider when writing a birth plan. So where you'd like to be when you give birth, if you'd like to involve water, who you'd like to be there, how you want to pass the placenta, thoughts on pain relief. Everything and anything you can think of, write it down. But write all these things down on individual pieces of paper. It doesn't work if you write a list. Now, once you've done this, put these pieces of paper in order of priority. And this is why it's called a priority tree, because you often end up with a cluster at the top and then a bit of a list at the bottom. So the things that you're not sure if they're greater or lesser priority end up kind of next to each other, and then things that you're more clear of lesser priority go down the bottom. If you do this, either do it as a couple or do it, girls, and then get your partner to come and have a look at what you've done. And the reason for that is that they can be a greater advocate for you when they know your wishes. Now, whatever you do, don't stick these pieces of paper down. They can still move. So literally and figuratively, be flexible. If things change, those priorities may change. But either way, you'll end up with a much clearer view of what is greater or lesser priority. If you'd like more information to help you prepare for labour and birth and early parenting, check out expectingclasses.co.uk. We offer a fully comprehensive antenatal course that's midwife hosted in your area, and also exactly the same course online, and this includes a video call with an expecting midwife.